Hi everyone, my name is Fabian Ebog. I'm a public health educator. I want to present our proposed suicide prevention program. Our target audience is Bill and Melinda Gates Foundation. We are making this presentation to assure Bill and Melinda Gates Foundation that the proposed program is based on a strong and sound public health foundation. The problem is suicide rate among girls in America is increasing because of lack of awareness, untreated depression, secondary to physicians' reluctance in prescribing antidepressants, and early puberty among other factors. According to the Centers for Disease Control (CDC), suicide is a leading cause of death in the United States. The rate of suicide in the United States has gone up from 10.5 per 100,000 persons in 1999 to 13 per 100,000 persons in 2014. Please. Though every age group is affected in one way or the other, girls at the early puberty stage of their life who are about 10 to 14 years of age are the most affected. For this age group, the percentage rise in suicide rate from the 1999 record is too high. In 1999, the suicide rate for girls 10 to 14 years was 0.5 per 1,000 persons. But in 2014, it has gone up to 1.7 per 1,000 persons. I'm sorry, I mean to say here that the 1999 rate for girls between the ages of 10 to 14 was 0.5 per 100,000 persons, which has now risen to 1.7 per 100,000 persons in 2014. The contributing factors are the economic stagnation that has thrown many people out of job and making it hard for them to get healthcare coverage. Other factors include the behavior of healthcare providers who are finding it difficult to prescribe antidepressants to some people who experience depression. Early puberty in girls has also been pointed as an issue. Other factors include substance abuse, mental ill health, the way social media reports and stigmatize mental health, and the easy access to fire. One might ask why sharp rise among adolescent girls' suicide rate. As stated earlier, early onset of puberty might be contributory, as some studies show girls start their periods earlier. Lots of changes happen at this particular stage of life. Hence, it is referred to as the storm and stress period of life. Puberty is associated with the onset of depression, and we know that depression is a major risk factor for suicidal behavior and ideation. We want to use the ecological model to analyze what helps and what hurts at all levels of influences: individual, interpersonal, community, organizational, and policy levels. At the individual level, knowledge helps. Knowing the risk factors helps a lot, but not having knowledge of risky behaviors don't. At the interpersonal level, good family relationship and support system is an asset to good mental well-being. Dysfunctional family or support system is associated with depression and suicide. Organizations like schools or workplaces that promote racial equality, fairness, mutual respect. Any organization that bullying prevails do not help. Having a community support hotline helps. Exposure to community violence hurts. For policy level, having a strict legislative policy influence that restricts firearm laws helps. But having a very costly, expensive healthcare system doesn't help at all. We have detailed proposed interventions in our logic, which can be seen in our logic model. But for the purpose of this presentation, we are presenting here 3 interventions we feel that, if done, will help solve the problem of high rise rate of suicide. First of all, we're going to create awareness of the prevalence and risk factors of suicide in the community. We're going to do that in the community, schools, at all levels. We propose screening for adolescent depression at all levels of healthcare, at the primary screening, and the screening at the secondary level with treatment, and the screening at all tertiary levels. Treatment of identified cases is an important intervention that will help a lot. We refer identified cases to community resources for treatment and purposeful social support. Evaluation is an important component of our program to assess whether we meet our set targets and objectives. As we stated earlier, the aim of this program will begin by creating awareness. So at the end of the program, we're going to assess whether parents, teachers, and community awareness has been created up to the level of 50% of what it was before we started the program. We are going to ask ourselves whether the number of people who know about and access mental health services has increased more than what it was before we started the program. As I stated earlier, our aim is to increase the number of people, children, adolescents, girls, and every other person that seek help in coping with the personal and emotional problems to 40% of what it was before we started the program. So we're going to assess whether we have achieved that level at the end of the program. So we're going to ask ourselves, did the campaign get more adolescents to screen for mental health and depression than had been before the campaign? Our long-term goal is to reduce the incidence of suicide among girls and the general population to 5 per 100,000 people from what it was before we started the program. Like every other program, there might be potential challenges and barriers to launching this program. Lack of adequate funds might hinder some interventions. Stigmatization of mental health, which hinder people from seeking help. Primary care providers' inability to detect suicide ideations. The cost of interventions that are very astronomical. And the people without proper coverage to seek help when they need help. To overcome some of the barriers, we are going to sustain fundraising program. We're going to educate people about mental health to overcome stigma. We're going to encourage equality between physical and mental health, and provide support. We're going to use advocacy for universal affordable health to be provided. Here is a logic model that shows the process of the entire program, from the gathering of resources, elbow hands, professionals, to activities we're going to perform, and the outcome and the evaluations. They are all shown here in the logic model. Here it presented are my references, the sources of my information and data used in presenting this program.